Hello and good afternoon. My name is Andrew Kubik. I am Deputy Director of the National Center for Religious Freedom Education and Research Fellow in Bioethics and Medical Conscience here at the Religious Freedom Institute. On behalf of RFI, welcome to our office and to the public launch of the Catholic Healthcare Leadership Alliance's Institute for Public Policy and Advocacy. The Religious Freedom Institute works tirelessly to advance religious freedom for everyone, everywhere. And this inalienable right to religious freedom is not limited to just belief. Rather, religious freedom, properly understood, acknowledges man's God-given right to express outwardly that which he embraces inwardly. The expression of man's deeply held religious convictions is fundamental to his individual flourishing, as well as to his flourishing as a member of a society in which he is a part. This expression has a rightful place in economic enterprise, in politics, in law, and yes, in healthcare. That is what drives the Religious Freedom Institute. In our Medical Conscience Rights Initiative, and in the partnerships with individuals and groups who share the same values. Values that uphold the dignity of the human person. Values that recognize the twofold purpose of medicine is to provide life-affirming care and to do no harm. And values that demand healthcare professionals be permitted to practice their art according to the dictates of a well-formed conscience. RFI is delighted to welcome the Catholic Healthcare Leadership Alliance here today because its board and its members share those same values. It is now my distinct privilege to call to the podium a man for whom I have deep admiration for, Dr. Stephen White. Dr. White is the president of the Catholic Healthcare Leadership Alliance. He also serves as the Catholic Medical Association's representative to the Subcommittee on Healthcare Issues at the United States Conference of Catholic Bishops. A specialist in pulmonary medicine, Dr. White is a proud husband, father, and grandfather. Ladies and gentlemen, please help me welcome Dr. Stephen White.
Thank you, Andrew, and good afternoon, everyone. As president of the Catholic Healthcare Leadership Alliance, it's my privilege to welcome you to the launch of the Institute for Public Policy and Advocacy on behalf of the board and on behalf of the Franciscan Health Alliance. I'd like to extend a particular thanks to RFI for hosting this event today, and I can't help but think that it's providential in light of the fact that their mission to secure religious freedom and medical rights of conscience aligns so closely with the work that we're doing as well. Tragically today, U.S. public policy and healthcare increasingly undermines human dignity, the sanctity of life, and medical rights of conscience. The mission of the Catholic Healthcare Leadership Alliance is to uphold these rights to ensure that patients can receive and medical professionals can practice medicine in accordance with the moral, ethical, and social teachings of the Catholic Church. This will require our commitment to advocating for public policies that not only protect but promote the truth, beauty, and goodness of the Catholic healthcare ministry that has been practiced in harmony with the mind and heart of Jesus Christ now for 2 millennia. The delivery of medical care in America, as you know, has become highly politicized and in a very highly polarized cultural environment. So our active participation in the political process is essential to safeguard the most fundamental ethical principle that has undergirded the medical profession since the time of Hippocrates, to do no harm. We do recognize that to do this, we must bring together experts from every discipline involved in the delivery of healthcare. And our intention is to accomplish this through the Institute for Public Policy and Advocacy. So as we launch the Institute today, you're going to hear from representatives from the medical profession, the Catholic hierarchy, the legal profession, and the policy community, along with the voice of the religious sisters whose orders established Catholic healthcare in this country and continue to administer health systems today. So we will hear by video comments from Archbishop Joseph Naumann of the Archdiocese of Kansas City, He is a member of our Episcopal Advisory Board. We'll also hear from Sister Jane Marie Klein, also by video. She is the former board chairwoman, and currently ex officio board member of the Franciscan Alliance, which is the first health system member of the CHCLA. We'll hear from Lewis Brown, attorney and director of the CHCLA Institute for Public Policy and Advocacy, and the vice president of public policy. We'll also hear from Grace Marie Turner, president of the Galen Institute and an advisor to the Public Policy Institute. Also Nina Schaefer, who's director of health and welfare policy at the Heritage Foundation and an advisor to the Institute. And finally, Josh McCaig, attorney and CHCLA Director of Education and the chair of the Symposium for the Advancement of Catholic Healthcare. So Lewis, I'll welcome you up to the podium.
Thanks. Great to be with you all. Really appreciate all the work that particularly Steve and Josh have done to get us to this moment. It's a real blessing to be with you today, and I also want to thank our excellent Religious Freedom Institute team, Andrew Kubik, David Tremble, Eric Patterson. Really grateful to collaborate with you. As Dr. White said, I'm the executive director of the Christ Medicus Foundation and our Catholic Health and Wellness Program, CMF Curo, whose mission is to share the healing love of Christ in healthcare with individuals, with families, with employers. That's having a profound impact, we believe, on our membership. I'm also blessed to be a part of this alliance whose mission is to advance also the healing love of Christ in healthcare. And it's a privilege to serve as the director of this Institute for Public Policy and Advocacy. There's a large debate about what Catholic healthcare is. Catholic healthcare ultimately is the continuation of Jesus Christ's ministry to heal and restore the sick and suffering in body, mind, and soul, so that individuals can be whole and so that individuals can be fully alive. Though I have many disagreements with the current U.S. Surgeon General, the General's report earlier this year on the epidemic of loneliness and isolation, as well as other medical research, indicates that the best health care outcomes and often the longest lifespans occur where people are alive spiritually and are in healthy, loving relationships with other people. Tragically, in much of our nation's healthcare system, the life and dignity of the most vulnerable are under attack. The moral and religious convictions about the obligation to care for the most vulnerable are under threat. We saw this dramatically yesterday in the awful, immoral, unjust passage of the constitutional amendment in Ohio that radically expands abortion and radically tramples on parental rights in healthcare. Not only do we have that tragic evil that happened yesterday in Ohio, but we also have in our nation's healthcare system a situation where human dignity is under attack, particularly the most vulnerable. We see immigrants with limited English proficiency who are reporting significant experiences of discrimination. We see patients with disabilities or who are aged suffering from unjust discrimination and in some cases outright denial of care because of their perceived low quality of life. We see patients who are racial minorities experiencing real racial bias and in some cases discrimination in hospitals and other medical institutions. And we see most tragically, as I said before, the greatest evil of our time, the intentional killing of unborn children through hundreds of thousands of abortions still every year. And of course, we have the ongoing onslaught against medical rights of conscience and religious freedom, ultimately the freedom to love, which is stripping human dignity out of our American healthcare system. Our healthcare institute, our Institute for Public Policy and Advocacy, will respond to the challenge, is responding to the challenge we face by protecting and promoting life, human dignity, and religious freedom in three particular ways. The first way is through educating federal and state policymakers and the general public about healthcare law and policy. The Institute will educate policymakers and the public on healthcare law and policy that truly protects the life and dignity of all persons, especially the unborn, pregnant mothers, the poor, and the vulnerable. We will educate and inform about policies that affirm the truth and goodness of the human body, and will educate policymakers about expanding access to life-affirming medical care that empowers human flourishing for all people. The second thing we're going to do, that we are doing in part today, advising Catholic bishops, Catholic healthcare leaders, Catholic lay leaders, and medical institutions on healthcare law and policy. In advising these various communities within Catholic healthcare, we will work with our friends and other faith traditions on identifying federal and state policy solutions that have the goal of protecting and strengthening legal protections for human dignity from conception to natural death for all people. We'll also work on expanding what I like to call healthcare civil rights, particularly for the poor, the vulnerable, the immigrant. We'll work on expanding medical access to medical care at the state and at the federal level. And of course, on protecting medical conscience rights and religious freedom rights for healthcare professionals, for patients, and families. The third and final project of this new institute is the ongoing filing of amicus briefs of select federal cases that give us a unique opportunity to support and protect life, human dignity, medical conscience, and religious freedom. Because of the hard work of Josh McCaig and some of our other legal partners, some of which I've been blessed to participate in, we've been able to file a few amicus briefs in key federal court cases that we believe have had a significant impact to protect life and to protect religious freedom. That is so very important. This is a significant day. We saw yesterday in Ohio a state constitutional amendment, once again, that just tramples on life. It tramples on protections for pregnant mothers. It really destroys our reading a lot of the work that's been done to protect medical conscience and religious freedom rights for healthcare institutions in the state of Ohio. It's not just that folks want abortion to be legal, it's that they want to coerce American healthcare professionals, medical institutions, Catholic hospitals, which provide so much of around about 17 to 20%, 15 to 20%, I would say, of all American healthcare delivery comes from a Catholic healthcare institution. It's not that folks that are pro-choice want abortion to be expanded, but they want it to be coerced throughout the American healthcare system and want to effectively abolish the participation of Catholic institutions in healthcare. We're here to stop that. We're here to expand Catholic healthcare access that empowers the fullness of human flourishing, particularly for people that are materially impoverished, folks that are immigrants, folks that come from historically marginalized backgrounds, folks that are most vulnerable to the elimination of caritas in the healthcare system. And so it's a blessing to be with you today. We're so grateful for folks that came from the federal government or that came from some of the, without outing folks that are directly here, but that came from the Association of Catholic Bishops. We are thankful for all of our partners that are here today and so grateful for the Religious Freedom Institute. Thank you.
Oh, the video's gonna go now. Oh, great. Okay. I'm gonna get out of the way then.
We'll now hear from Archbishop Naumann from Archdiocese of Kansas City.
I'm Archbishop Joseph Naumann from the Archdiocese of Kansas City in Kansas. I regret not being able to participate in this year's Catholic Healthcare Leadership Alliance Symposium, and in particular, I am disappointed to miss the launching of the Alliance's Public Policy and Advocacy Institute. I'm grateful and delighted that CHCLA has decided to establish the Public Policy and Advocacy Institute. Catholics are called to allow our faith to inform and guide every aspect of our lives, including our professional life. The care and healing of the sick was an essential part of the ministry of Jesus. Our Lord frequently in the gospel manifested great concern and compassion for the sick. Similarly, the Church from its earliest days continued our Lord's ministry of compassion, care, and healing for the sick. Hospitals grew out of a Christian culture that sought to provide the best possible medical and spiritual care for those suffering illness. Foundational to Catholic health care is the Christian ethic that acknowledges the dignity of every human person because we're created in the divine image and of such worth that Jesus gave his life on Calvary for each of us. While our Catholic faith motivates us to accompany with compassionate care those who are sick and suffering, the understanding that minimally physicians should do no harm to their patients and treat them with the utmost dignity and respect is not dependent on religious faith, but is a fundamental human right that is evident to everyone through reason. Sadly, in our own time, many in the dominant secular culture classify as healthcare the intentional killing of unborn children, the practice of euthanasia or medically assisted suicide for the seriously ill, debilitated, and depressed, and the physical maiming of those experiencing gender confusion. These are all violations of the most fundamental human rights. They are not health care. Equally distressing is the threat to the conscience rights of medical professionals who refuse to participate in these and other practices that are contrary to the ethical and religious directives promulgated by the Catholic bishops of the United States. Laws and public policies are important because they not only permit, but they actually promote practices that violate human rights and moral truths. The law is both an arbiter and a teacher. When our public policies permit practices that violate fundamental moral principles, then our laws actually are teaching moral and ethical errors to the young. Thank you for all that you do in your medical practices to heal the sick and the suffering. Thank you for being human instruments of our Lord's healing in our society. Thank you for your desire to promote laws and public policies that protect the sanctity of life, make quality health care accessible to everyone, treat the sick in a manner that respects their dignity, and defend the conscience rights of medical professionals as well as healthcare institutions. I pray that our Lord, the divine physician, will bless the Public Policy and Advocacy Institute's efforts to protect the dignity of the human person, guard the sanctity of human life, and uphold the conscience rights of doctors and nurses. May God make your gathering fruitful in the ways that he desires. Thank you, and God bless.
We'll now hear from Sister Jane Marie Klein from the Franciscan Health Alliance.
Franciscan Alliance is pleased to join the Franciscan Alliance is pleased to join the Catholic Medical Association, the Catholic Bar Association, the Christus Medicus Foundation, the National Catholic Bioethics Center, and the Catholic Benefits Association as a member of the Catholic Healthcare Leadership Alliance. CHCLA is bringing together leaders throughout the Catholic community who are committed to strengthening the mission of Catholic healthcare providers and defending the religious freedom of faith-based ministries. The ability of Catholic healthcare providers to minister to the sick and vulnerable in our communities without compromising our spiritual beliefs and values or the moral teachings of the Roman Catholic Church is being threatened by those who support abortions, euthanasia for the terminally ill, gender alterations, sterilizations, and disregard for the spiritual, physical, and emotional well-being and rights of all God's children. The rights of the unborn have given way to what is expedient for others. Our sacred obligation to attest to and uphold the moral teachings of the Church concerning the sanctity of life throughout its natural progression from conception to natural death is being challenged by those who wish to secularize all healthcare providers. CHCLA is being formed to be a beacon of light and truth, an organization that will defend the rights of the faith-based providers to deliver care in concert with their religious beliefs. Many in the executive and administrative bodies of our government, as well as the legislative branches, are attempting to secularize faith-based healthcare ministries through legislation and administrative regulations. Attempts have been made to force faith-based healthcare providers to violate the fundamental teachings of their faith. Care for the poor and elderly is a sacred promise, but underfunded by government. There is a disparity in access of care throughout this country. A disproportionate number of people in our country, the poor and the elderly, the marginalized, and those without a voice, struggle to receive adequate care. CHCLA wants to be their advocate. Franciscan Alliance is proud to be a part of an advocacy forum that defends both the dignity of all persons and religious freedom.
I will tell you, it is very humbling as a new and received Catholic to follow Archbishop Naumann and Sister Jane Marie and their really important statements about the work of this organization and the new Institute for Public Policy and Advocacy. I run a think tank called the Galen Institute and have worked for 25 years on health policy development, and particularly ideas that put doctors and patients in charge of healthcare decisions. And for most of my time at the Galen Institute, it has been my privilege to work with Dr. White, the Catholic Medical Association, and now the CHCLA in trying to help shape ideas and policies that advance life and subsidiarity and the dignity of the human person. So that is something that is so very much ingrained in our work, even though we're a secular think tank. It's really a privilege to talk about these important goals and principles. This spring, I had the privilege of joining Dr. White and Lewis Brown as they visited a number of offices on Capitol Hill. And the leadership, they were meeting with members of Congress, with officials in leadership. They were meeting with senior staff people to introduce the Catholic Healthcare Leadership Alliance. And so they understood this new organization and its role, and they very much welcomed this alliance. One of the things that you find in working in Capitol Hill is that they like to hear individual voices, but it's much easier to work with an organization that has voices aligned, basically in a chorus. Not everybody's going to be exactly on the same page, but a chorus of voices really helps them as they're developing policy and really trying to advance these ideas. Most of the members that they met with have very much support the goals of the Catholic Healthcare Leadership Alliance. Many of them have sponsored legislation, voted for legislation protecting life, religious freedom, conscience rights, and they were pleased to realize there's a new organization to really help them in getting the message out about the importance of these initiatives. But that's really only the beginning. Policymakers are dealing with a huge range of issues at any one time, some of their own initiation and some just in response to what's happening in the world. And they really rely on organizations like this to help them develop their policy initiatives and to really not only tell them, here's an idea that we think you could advance that would further our mutual goals. And sometimes it serves as an early warning system of dangers, of things that they need to be aware of that are coming. And so they see this conversation as tremendously important. And now with the specific Institute for Public Policy and Advocacy, and with Lewis Brown as the director, the title director, president, director is perfect because Lewis is so well known on Capitol Hill, so highly respected in Washington, and he's here. And so it's really easy for him to be present and also to bring others together to Washington to really facilitate this conversation. So there are a number of policy initiatives. I think one of the things that so many people don't understand is that when you talk about patient-centered, market-based health reform, competition in health reform, that's the way that you put the patient at the center. When you talk about government-run health care, who's in charge? The government's in charge. And that's who writes the rules, and that's who then the whole system has to respond to. But it's only when we have patient-centered health care that we really are going to be able to attend and to put the dignity of the patient at the center and have a system that relies on doctors and patients for decision-making rather than the government. So I'm really proud and privileged to be part of this effort and look forward to many years of advocating for these ideas. And I'd like to invite my colleague Nina Ochorinco-Schaefer, who we've worked together with for many, many years on policy advocacy, to talk about her perspective on this new organization.
Thank you, Grace Marie, who's been a wonderful mentor and inspiration to many of us in the public policy space for decades now. And thank you for having me here today. Like Grace Marie, I'm humbled and I'm honored to be with such a great group of people who are united in their effort to promote healthcare policies that uphold Catholic teaching. Many, like Grace Marie and myself, have been steadfast champions for putting the person, or as Lewis likes to say, the whole person, at the center of our healthcare system, and restoring really the essence of the doctor-patient relationship, which is so critical to that equation. Now we have a new ally to work with in the healthcare community to collaborate and expand on our mutual efforts together together under this umbrella. If there has ever been a time where we have needed an organization like CHCLA and the new Institute for Public Policy and Advocacy, it's now. We need to bring some moral clarity and ethical clarity to this situation and really to soften and transcend the political divisiveness that we have seen in the discussions around policy as a whole. The healthcare landscape, as Grace Marie has noted, is changing rapidly, some for the good, many of which you all here are doing on the ground in your local and community areas, but some for the worse, as we've heard from the speakers today about what's happening in society as a whole. There needs to be a place where policymakers and thinkers can go and get a perspective that reflects and is grounded in Catholic teaching. This institute, under its great leadership, will fit that need at this very important time that we're in. There are so many opportunities to engage on the healthcare topics, to provide sound guidance from a Catholic perspective, important issues from basic, practical kitchen table issues like improving access and quality of care, reducing the high healthcare costs and making healthcare more affordable for families, ways to strengthen the doctor-patient relationship, empowering patients to be the ones who control and decide what their healthcare looks like, and to make the healthcare system accountable to the patient, not to the government or to dictates and mandates. There are also larger moral and ethical issues that have been discussed today. The issues that come to my mind immediately, the dangers of chemical abortions, especially in the post-Dobbs environment, the need to support women and their children during their transition, the serious ethical questions around the end-of-life care and our treatment of the elderly and disabled, as well as the need, especially these days, to protect minors from the dangerous gender surgeries that are rampant in our country. I am excited and grateful to be a small part of this larger group here today, and for the important contribution that this organization will bring to the policy discussion and debates from now into the future. Thank you.
I'm Josh McCaig. As Steve introduced me earlier, it's my privilege to be here, not just as a member of the CHCLA board, but also as a representative of the Catholic Bar Association. The Catholic Bar Association is fully supportive of CHCLA. It's throwing its entire weight behind this initiative. It is extremely excited to work with the caliber of people that we've brought together moving forward on the myriad issues that have been talked about today. The Catholic Healthcare Leadership Alliance's mission is to support the rights of patients and healthcare professionals to receive and provide healthcare in accordance with the moral, ethical, and social teachings of Jesus Christ, and the Church through ongoing evangelization, education, advocacy, and mutual support. One of the foundational pillars of CHCLA is advocacy. And while the CHCLA Institute for Public Policy and Advocacy is formally launching today, it builds upon the years of work and experience that CHCLA members bring to this organization. For too long, the Catholic voice in the public policy arena has been divided by partisan politics, where the principles of Catholic social teaching are split up and claimed by different political parties, leading to division among Catholics, and this includes the fundamental rights involved within Catholic healthcare. This division has created a situation where politics guides religious beliefs as opposed to religious beliefs informing politics, leading to further disunity within the Church and a weakened voice in the public square. The CHCLA Institute for Public Policy and Advocacy's purpose is to bring unity to the Catholic voice in the area of healthcare and speak the truth of Christ's teachings on the healing ministry, a truth that upholds the dignity of the human person, a truth that seeks to provide access to quality healthcare to everyone, a truth that defends the sanctity of human life, a truth that is a witness to the healing ministry of Jesus Christ through the love and compassion of so many healthcare professionals working tirelessly to bring hope to patients and families who are suffering and in need. Now, unfortunately, the ability of Catholics to practice in the healthcare profession is constantly being challenged through anti-Catholic legislation seeking to diminish and in some cases destroy conscience rights protections. The CHCLA Institute for Public Policy and Advocacy will speak out against any regulation or legislation that seeks to impact the conscience rights and religious freedom, liberty freedoms of Catholic healthcare professionals and patients to provide and receive healthcare in accordance with the teachings of the Catholic Church. To carry out this mission, as Lewis mentioned, this institute will build relationship with partners to create coalitions on relevant issues impacting Catholic healthcare. It will analyze legislation at the state and federal levels, as well as government regulations that impact Catholic healthcare. It will provide educational materials to assist in the evaluation of policy, and it will file amicus briefs, as we have done, in court cases when required. CHCLA is committed to being a strong voice for Catholic healthcare and public policy, and we look forward to working with many of you very soon. Thank you.
Before we take any questions, I, again, just want to thank Nina. I was joking that when I was at HHS in the last administration, she was my boss's boss's boss, kind of. And she just did remarkable work. And we really have all learned so much from Grace Marie Turner over the last many years. I don't remember quite the first time I met her, but she has been a remarkable leader, a remarkable teacher, just working really hard, whether she gets the credit or not. And we're so grateful for her virtuous leadership and that of Dr. White. I just wanted to make, just take maybe 90 seconds to make a point, and it just really builds on what Josh said. What we see right now, and this is in particular for some of our friends that came here today, what we see right now in our healthcare system, what I've seen, what I was most shocked by at HHS, I knew how bad unfortunately, the plague of abortion is in our country. But that plague of abortion has grown like a cancer into what I call an abortive throwaway culture within the healthcare system. Of course, it's impacting pregnant mothers, it's impacting the unborn, but it's grown and metastasized such that there is a mindset that if you as a patient are deemed to be unfit, deemed to be inconvenient, deemed to be unnecessary, that you can be discarded, that we can deny you care, that we can discriminate against you, and unfortunately, in some cases, we also see cases of passive euthanasia. And we need to counter that, and we believe that we can counter that through Catholic social teaching, as Josh articulated. Looking at these issues in a truly Catholic way. How do we protect human dignity? How do we, through healthcare law and policy, empower human flourishing? How do we use this beautiful teaching to inform our healthcare law and policies at the state and at the federal level? I think of the work of state Catholic conferences. I think of the work of the U.S. Conference of Catholic Bishops. I think of the bishops that are trying so hard to provide greater life-affirming access at the state level. How can we inform them? And so we have a lot of remarkable ideas. There's great ideas we have from the Gateway Institute, excellent ideas from the center that Nina runs, other partners of ours. Let's bring Catholic social teaching, which we believe is universal, to bear on these issues, life first and foremost, but on these issues that are impacting human dignity, so that we can rescue our brothers and sisters so in need of love and care in our healthcare system. Issues that come to mind, true healing for our brothers and sisters who are suffering through gender confusion, true medical access, high quality medical access. We're joined by my friend Lisa Marie Carzon, who's doing remarkable work to provide care, to help provide care for folks in Detroit. How do we expand that and allow that to be more fully empowered? How do we protect the rights of persons with disabilities in our healthcare system? There's a new disability discrimination regulation. There's some things that I agree with in there. There's some things that I don't agree with. But how do we partner in a bipartisan way, perhaps, on protecting persons with disabilities in the healthcare context? So what we're here to say is that we're here to serve the general public, state and federal policymakers, folks from various and different institutions and think tanks, and people within the church to say, here are some ways where our beautiful universal faith informs what we do, whether you're a Democrat or a Republican, and let's work together and collaborate for the common good in America. And so with that, we're happy to take any questions. I'm happy to answer any questions that folks here might have whatsoever, or that our panel would like to decide maybe for a few minutes if there's any questions, please.
So what was you? Sure. What are the priorities in the next few months for the Institute for Public Policy and Advocacy?
Yeah, I think the biggest thing that we started to do this a little bit, but we wanted to do this more, is to have conversations with folks that are operating within the national space on Catholic healthcare issues, and then also at the state level. We want to talk to state Catholic conference directors in an ongoing way. We'd like to talk to Catholic health administrative leaders that are thinking about what can I do in my state to take care of the poor and vulnerable, and have ongoing conversations. We've already started some of those discussions to identify legal and policy solutions at the state level in particular for healthcare leaders that are running hospitals and systems, and also for Catholic bishops and lay leaders at the state level, trying to figure out what do we do about the myriad problems in our healthcare system and provide solutions in a bite-sized way that's digestible and that they can move forward on. So that's the most important thing the next few months. So, any other questions? Sure.
Hi, thank you everyone for this. what would be the approach that you might take when it comes to universal health coverage and efforts that are being taken to promote that in the U.S.?
Right. Yeah. So the two principles, again, we come back to our Catholic social teaching. The two principles that we're that help amongst the many principles that inform us as Catholics that are engaged in healthcare, maybe I think of three. You have the principle of life and human dignity, which obviously permeates everything. You have the preferential option for the poor. Our beloved St. John Paul II talked a lot about that we look first at how does a policy impact the most vulnerable, the person that we're, in a certain sense, as Jonathan Reyes says, we're all poor, but someone who's most materially impoverished and so weak that they need the help of others in a particular way. We all need help. We all need the support of our brothers and sisters. And I also think about, particularly here, assuming the preferential option for the poor is considered, we think about the principle of subsidiarity and solidarity, right? That we are called to be in solidarity in our heart, in our mind, in our actions with our brothers and sisters. That's the work that we see done at Franciscan Health so beautifully in the Midwest. That's the work that Lisa Marie Carzon and others, Dr. Kanish, Dr. Meyer, will be doing at the new Heart of Christ Clinic in Detroit. And we carry that out most powerfully and most potently when we're closest to the problem. And that's the principle of subsidiarity. The impact of our loving, the impact of our care is closer when we're closer to the problem. And so that is a vital concept. We think about the principles of subsidiarity, that when we're closest to the problem, we can love the best, we can care for the best, and the principle of solidarity, that we are truly in solidarity with the weakest and the most vulnerable. Thinking of it that way, in that Catholic way, and also recognizing that unfortunately, so much of American healthcare is a delivery mechanism for the throwaway culture of death. I would say prudentially, a universal, single-payer, government-controlled healthcare system is not the way to go. That there's profound problems in this time in history. I wouldn't say at all times in history, but in this time in history, there are severe problems for the culture of life, for subsidiarity, for solidarity, and it also takes away, kind of strips patients from an appropriate control and exercise of their decision-making power over their own healthcare, which is so vital and so important. Grace Marie, please.
So I have been invited to testify at least half a dozen times in Congress on Medicare for All, and usually I am the one witness who's may suggest other ideas. One of the things we find with a government-run single-payer healthcare system is that the poor and vulnerable wind up at the very bottom. They have the hardest time accessing the care they need. Look at a Medicaid patient, for example, today, really can struggle to be able to find a specialist if they need care, even sometimes to just find a physician, a routine physician. Dr. White does his best to take care of Medicaid patients, but it's very hard to keep a practice open when, as he has experienced after a very complicated course of treatment for a patient, he gets a check from the government for 6 cents. There's no way you can run a practice when that happens, and that's what government does. It underpays people to the point that they really can't provide care for the most vulnerable. And I don't think there's any disagreement anywhere that we should have a universal health care system, but how the money flows is really what matters. And if individuals have greater control over the resources, then the system is going to be able to respond to them so that they get the care and treatment that they want, and they're able to make the choices that work for them and their families. So there's no argument against universal coverage, but there is an argument against government-run single-payer system that really disadvantages the dignity of the individual.
Yeah, and to add on to that, an analogy, two quick thoughts if we have time. An analogy that I like to use, and maybe it's a little providential, we pray for whoever's being impacted by what sounded like the siren of a fire truck. If I'm in California, let's say I'm in DC, and there's a problem in California, there's a particular emergency that's going on, and maybe it's in an ongoing way. I might have a lot of compassion and care and concern, but my ability to love and care for that person in California from Washington, D.C. Is not going to be very great. The power of it, my understanding of the problem, my understanding of the need is not going to be very great. But if it's across the street, i.e. why we have fire stations so close to wherever that fire might be or whatever the problem might be, my level of understanding, the potency of my care and concern for that person, that patient, that family is going to be a lot better, which is why, as we know, subsidiarity would say that let's look to the family, let's look to the church, let's look to religious medical institutions, let's look to the community, the county, and even state solutions. Nina and Grace Marie have done a great job on what are some of these state solutions to some of these healthcare entities. The governor of a particular state, the state legislature there, we were talking about the opioid issue before we started. Folks that are caring for persons that are addicted or struggling with certain serious chronic illnesses, they're going to understand it better if they're closer to the problem and continuously working on that. So that's what we think is really important. It's a really good question. We'd love to see the full strength, the private and public strength of the American people to come together to solve some of these serious healthcare issues. Any other questions? Robert, please. Yeah. Thank you, Robert. Thanks for being here. So great to see you.
I'm very glad to be here. Thank you for doing this, and congratulations to you all on this launch. So in the vision for the work of the Institute, I'm wondering, do you see the role gravitating more toward primarily almost as a a think tank of experts in Washington helping to share very good policy ideas, or slash one or the other, or mobilizing and networking grassroots of providers in a new way around the country to help influence their elected representatives in that regard as well, to adopt those policies?
I would say both. We see it as pulling together, to some extent, an institute where folks can really say, this is how the church thinks about these issues. And there is, in my opinion, there is not a faithful Catholic entity that is providing guidance, education, and advice about Catholic healthcare in a national way until now. And so that's on public policy, and that's very important. And so we want to pull together the richness of the teaching of the church that you know so well, Robert, to speak to these important healthcare issues, and to be a guide, to be a bit of a teacher, to be an advisor to the bishops, to the diocese, to the bishops' conference, to the state Catholic conferences, healthcare institutions, but then where needed, to bring together various medical professionals and health institutions as a united front to talk about what healthcare reform that empowers human flourishing should look like. So that's a little bit of both, probably a little bit more of an emphasis on the first rather than the second, but a little bit of both. So if that answers, we want to serve, not to sound trite or cheeky, but we really want to serve some of the folks that are here. We're so glad you're here. We're here to serve you. So that's what we would say. Archbishop Naumann, folks like Sister Marie Klein.
Thank you for that.
Yeah, thank you. Any other question? Yeah.
So one of the things that has been observed by many colleagues, whether it's Catholic Medical Association or even with CMDA, is the education system that we have to train healthcare professionals. And there's a couple of issues there. One of the issues is the education that they receive when it comes to the formation portion, whether there is a component that they're also taught in throughout the years that they're receiving their professional training, whether it's through clinicals or through classroom settings, but teaching them or having courses based on formation, right?
Right.
Like what are Catholic social teaching, things like that. How do they handle difficult situations in the workplace? How do you handle the different policy? Like what are their rights to be able to refuse doing certain practices and whatnot? But that in addition to that, the second part of this is, you know, so that would be one, whether to work with that with current institutions, or educational institutions, but also the second question I would have is there a desire, whether it's far in the future or more immediate, either through the Institute or the Alliance, a desire to also create more educational institutions to train more people? Because we've identified there's a huge shortage, right?
Sure.
And
Yeah, no, I can handle that. And then Dr. White, if you want to come in too, feel free. But so that's a great question. Thanks be to God, perhaps providentially, we do have a plan to do on your first question. We have a plan as CHCLA through our Center for the Support of Catholic Healthcare Ministry to collaborate with a phenomenal Christ-centered Catholic medical institution in the Mountain West on educating and forming in an ongoing, systematic, programmatic way Catholic medical professionals and lay leaders interested in opening Catholic clinics on Catholic identity, even down to the HR, even down to the EMR, even down to how to manage the financials, how much time do you spend with the patient. And we're in very opening discussion to launch that, to support our friends in launching that in the spring. So you're dead on. A lot of folks are like, well, what does a Catholic healthcare institution look like in the nitty-gritty? And we have a partner, so to speak, one of our members that we believe we can partner on that and raise up high what they're already doing. Dr. White, anything? No, okay. On the second question, can you remind me, Mary?
The second question was on if there's any sort of plan or desire to expand the amount of institutions that there are to do Catholic education of professionals.
Right. So
medical
a good partner of the Christ Medicus Foundation is Catholic Health International, led by Jared Palazzolo, who's a wonderful person doing really hard work. A very exciting announcement that you may have heard of with Benedictine College, President Steve Minnis, who's awesome out there, and their intention to move forward with a new Catholic medical school in Atchison, Kansas. We need more of that, and anything that we can do. We can't do everything, but we're there, as we were talking last night, to raise the outstanding work that Catholic medical professionals and professors are doing and thinking about these things. Raise it up on high, so that it can spread far and wide.
Related to that question, obviously currently there's a lot of Catholic medical professionals, or students rather, who are training in non-Catholic institutions but still trying to preserve their integrity as a Catholic medical professional and carry that into the workplace. But just from family and friend experience of people going through that education, it can be extremely isolating. You are the only one with these viewpoints. Is there any interest, and if not, I think I would encourage you all to consider some sort of resource generation, just a bank of resources even, something that can be on those types of campuses to reach out to those students to support them, especially if they're not able to go to a Catholic institution for their learning.
I'll let Dr. White answer. Just one thing is that one thing we are doing, CMA, Catholic Medical Association, has an amazing boot camp, and encouraging, helping them to expand is a large part of the solution to us to that, but please, yeah.
Yeah, I'll just follow up on that. I would highly encourage those families and those students that are currently there and feel isolated to absolutely join the Catholic Medical Association. Not only do we have a boot camp, but we have outreach. The amazing thing for me as an old guy is to see the exponential growth in the Catholic Medical Association among medical students and residents. It's going through the roof because they know we exist. They know we have the resources to help them in terms of legal representation if their consciences are being, abrogated. So just a strong word for the whole purpose of this alliance was to bring the resource together of medicine, of law, of bioethics, of public policy, of theology, of philosophy, all of these disciplines that are integral to what I do at the bedside each day, so that all of those resources in a united fashion could support the next generation and the next generation of Catholic healthcare. So please encourage them to contact us at the Catholic Medical Association, and we have the resources available to help them.
And another, that's great, Dr. White. What I will say is, because you said that, I think you're dead on, and we need to something that we're going to have to do is putting together a fact sheet, a know your rights sheet, specific to Catholic medical students. It doesn't really exist, but that's something that we're going to do, and it's a great suggestion. So, thank you, seriously. Any other questions? We don't want to keep you here. It's Washington, so it's like, I'm starting to feel nervous about folks leaving, but yeah, okay. Thank you so much for coming. We're so grateful for folks that are following online at home or in your workplace. Thank you for joining. Please pray for us. We'll pray for you. Really appreciate you coming. Thank you. God bless you.